We're just proud of you. Your Excellency, thank you to you and your lovely wife and this incredible staff for having us in your home here tonight and for what this means. I'm thinking about the quote from Margaret Mead when she said, "Never underestimate the power of a small, dedicated group of individuals to change the world. Indeed, it is the only thing that ever has." Dad, who started Project C.U.R.E. back in 1987, went to a place called Tashkent in around 1995, 96. I need to ask him and get that date nailed down. And he came back with a story of some wonderful people and some new friends and an absolutely beautiful place in the world. And so when we started talking about the tragedy of the Aral Sea, it really resonated because Uzbekistan has been an important part of Project C.U.R.E. for a long time. It's been an important part of my family for a long time, and we consider the people of Uzbekistan to be friends and family. And I heard about this catastrophe, climate change. And sometimes when it happens in Malawi and it's a cyclone, it happens overnight. If it's an earthquake, like the ones that we have seen recently in Mexico and Turkey and Syria, it's minutes. This was years. And nobody said anything about it. One of the worst man-made climate catastrophes in the history of mankind, and nobody said anything about it. That is a responsibility that we who live outside of Uzbekistan carry, because we should have said stop. And it wasn't that time of history when we could. I don't know what we would have done about it. But that doesn't mean that we have to continue that pattern. We can talk about it now, and we do need to talk about it now, and we need to go beyond talking and do things. We need to take care of those people. Here's what we know. We know that we can take all the stones in the world and build schools, but if those little girls are sick, they don't go to school. We can create all kinds of economic development programs, but if that mom or that dad is sick, it doesn't matter. The rebuilding of the Aral Sea region is going to happen with healthy people. And Project C.U.R.E. is committed to make sure that the people of that region are healthy. And that's why when we started talking about the opportunity that we had to actually change the world, Project C.U.R.E. said, yes, we are committed, we are going to do this, and we will be here until you tell us we don't need you anymore. That is, by the way, the goal, should be the goal of every NGO, right? To work ourselves out of a job. But until that happens, we will be here with you. We've had some fun doing this. In the middle of COVID, Uzbekistan bought a very beautiful Boeing 787. It is absolutely gorgeous. We got to see that thing sitting on the tarmac at the Boeing plant. And Dean and I went up and we met with the ambassador and a bunch of staff. We met with the entire flight crew. Here's what I didn't know, was that the first plane flight is empty. They got the flight crew, right? They're working on the coffee makers and the pilots are playing and all that stuff. But there's no passengers that first flight, which means there's no luggage the first flight either. And so Boeing allowed us to fill that entire airplane full of medical supplies and ship that, and that's where it went. And we've got some really fun pictures. Now think about this, because all of our pictures were all in masks, or we're standing a long ways away from each other in front of that big plane, but it was a big, beautiful plane, and it worked. It was a fun project. And now we're working with many of the NGOs that are in this room tonight to continue that legacy of let's ship the things in containers. It may not be a brand new 787 Dreamliner, but we're getting these things in semi-truck sized containers. And so we're working to raise the money to ship the containers over there. All of the medical supplies and equipment that are inside the containers, about $350,000 to $400,000 each. Every one of those 40-foot containers that we ship into a region where people really, really need it. So I want to tell you thank you for being part of that small dedicated group of individuals, because we are going to change this part of the world. I have all the confidence in the world that we can work with those doctors and nurses to take care of those little kids. We don't know if the next Nobel laureate could be one of those kids from the Aral Sea region. We don't know that. What we do know is that if we don't intervene, and if we don't do the things that Marguerite talked about, that won't happen. I tell my team all the time, people talk about moving the needle. Let's not move the needle. Let's bend it back in the opposite direction. Let's go back and do what we should have done and say that's not right. It's not okay for moms in the Aral Sea region today to have to face cancer without health care. That's not okay. Let's change that picture. Thanks for being a part of that small dedicated group. Thank you again for having us together, and let's just see what we can do to change our world.
Well, that is the difference between someone who's fasting and who's not.
Assalamu alaikum wa rahmatullahi wa barakatuh. Peace be upon all of you. My name is Ahmed Shahata. I'm the CEO of Islamic Relief USA. It is a pleasure joining you today at the Embassy of Uzbekistan. This is the second time this month. I was here last week, so I want to assure all of you that you're going to have a nice dinner. We are here on behalf of Islamic Relief to support and to commit to the critical medical situation in Uzbekistan, as I was just told by one of my colleagues about the situation, and Mr. Ayub as well. Last week he was explaining to me the situation, unfortunately I never heard of, but this is our responsibility as a human being and as the largest Muslim charity in the US to take our decision and to jump in immediately to help and support, as I promised the ambassador. As the nation's largest Muslim humanitarian and development organization, IRUSA has a long-standing tradition of supplying life-saving medical aid and gift-in-kind donations to remote regions and countries across the globe that are otherwise difficult to reach. We are proud to continue our outstanding partnership with Project C.U.R.E, where we have successfully delivered millions of dollars of gift-in-kind donations to countries such as Morocco and Sri Lanka. In 2023, Project C.U.R.E approached us with the concept of sending gift-in-kind medical equipment and supplies for Uzbekistan after conducting a comprehensive needs assessment. Based on the need assessment, it was recommended that we deliver 4 containers of medical equipment and supplies to the Republic of Karakalpakstan in Uzbekistan. IRSA and Project C.U.R.E coordinated with the Embassy of Uzbekistan for the delivery of 4 40 food containers of medical equipment and supplies. In March 2024, Islamic Relief USA committed $144,000 to cover the cost associated for shipping the 4 medical supply containers of gift-in-kind donations to the Republic of Uzbekistan. I am proud to announce that the Ministry of Health of Republic of Karakalpakstan will receive and distribute the 4 containers of donation across local community health centers. Through the significant gift-in-kind donation, we'll be able to help over 190,000 beneficiaries on Uzbekistan. IRUSA hopes that through this incredible partnership and efforts, we will continue to build strong and long relationships with the Republic of Uzbekistan, and it is local and work together to ensure that the healthcare needs of all people are being met. During this blessed month of Ramadan, I'm honored to unite in the spirit of giving and being new collaboration that will have life-changing impacts on the people of Uzbekistan and help strengthen the health system in Republic of Karakalpakstan. Thank you for the opportunity to join you today and to affirm and pledge Islamic Relief USA commitment to delivering high quality medical supplies, equipment toward the humanitarian relief effort in Uzbekistan. One more time, thanks so much for having us. And very soon we'll be visiting Uzbekistan under the leadership of the ambassador to see how Islamic Relief USA can contribute and help and support more for our beloved people of Uzbekistan. Thank you so much.
Well, the podium is open if anyone else is coming here to provide support, as my brother did. So thank you so much, Mr. Shahata, and you can see the energy in how we work, and you can see the passion, and we're long-term partners, and we're committed to do more. Now I know this time I think the speaker wants to get to the food more than the audience. So this is I just wanted to highlight what we have already done. I believe DCN talked about some of the work we have already done in Uzbekistan, work with partners like Islamic Relief. And that's how we leverage efforts and amplify impact. So we have done 5.2? Okay. 5.2 gift in kind donation distributed among health facilities in Uzbekistan. And it's there in that green. So you could tell from there we're planning to raise at least 1.6 million. That is for the shipping cost. So we basically have all the equipment and supplies here in the US. We try to get them from here to there, and that requires us to raise 1.7 million to ship up to $20 million worth of medical equipment and supplies. So then the numbers you can tell there.